Hello, everyone, and welcome to this webinar opportunity around contract negotiations. My name is Shawn Martin. I am the Executive Vice President and Chief Executive Officer of the American Academy of Family Physicians. And today I'm pleased to be here with two representatives from the Missouri Academy of Family Physicians. First, Dr. Kara Mays from St. Louis, Missouri, and Dr. Afsheen Patel from Lee's Summit, Missouri. And I would turn to ask them to introduce themselves a little bit more about their professional journeys and practice locations. And then we're going to have a conversation together today around some important aspects of contract negotiation, gender equity in contract negotiation, and provide some best practices for you on how you should approach contracts in your employment situation. So Dr. Mays, I'll turn to you.
Perfect. Good afternoon, everyone. I'm Kara Mays. I finished my residency program in family medicine about 12 years ago at Mercy St. Louis residency program. And right away after that, joined the faculty of that program, practiced at full spectrum family medicine to start with. I did inpatient, I did obstetrics, I did a little bit of everything. And over the years have actually slowly transitioned to where now my practice is solely outpatient obesity medicine. I've had lots of different contract negotiations along the way, although to be fair, mine have all been with the same employer over these years. I'm currently the Missouri Academy of Family Physician board chair.
Great, thank you. Dr. Patel.
So I'm Afsheen Patel. I currently practice out in Lee's Summit, Missouri. So I graduated 10 years ago from Mizzou, which is the University of Missouri out in Columbia. And when I graduated, I moved to Jefferson City, which is a smaller town, and I started private practice there. That was my first contract. I did not know how to negotiate it. I made several mistakes there. And like most physicians who graduate, I left after 2 years, just realizing what I had never negotiated for. And then I moved to this current job that I'm in, and I've been here for 8 years now, and I'm employed by St. Luke's Hospital. Definitely some things I wish I would have known signing in the contract, but I can say I was better prepared after my first one. So I'm excited about this topic today.
Well, that's great. So that's an excellent segue. So I think both of you talked about your personal experiences with contracts, both good and bad. So maybe we should start with some red flags. What are some things, common red flags that employee physicians should watch for as they begin their contract negotiations, particularly earlier in their careers? And I would look to the two of you for your feedback, and then I can, if it's okay with the two of you, I can provide some perspective from the Academy and some of the resources we have available to answer many of the issues that you probably will raise. But red flags, what did you learn?
So with my first contract, first, my salary wasn't negotiated. They gave me a lower salary saying I was a brand new graduate and I didn't know what I should have negotiated for. And I realized I should have asked for a higher pay. And that was the first thing that I wish I would have known. The second thing is, because it was a private practice, I never negotiated. If I was to have a maternity leave, what would that look like? Would I have an overhead? And that was the biggest thing that affected me. I was a young physician graduating. Of course, you spend so many years in med school. By the time you graduate, you want to have your children, then you're in your 30s. And no one tells you with your first contract, well, maternity leave is something you need to talk to your employer about. There's nothing wrong with it. It's a part of life. You're a physician. You advocate for your patients. You advocate for prenatal care, postnatal care. What about you? And so I think that was one of the big red flags that if I was to tell future graduates to ever, or anyone negotiating a contract, to definitely ask for and not be embarrassed about it.
Mm-hmm. Kara?
Yeah, I don't know that I have any specific examples of big red flags. I'd be interested to hear from the AAFP's perspective, really where, if there are some things that are red flags. I've been happy enough in my positions that I really don't have any big concerns from my standpoint.
Yeah, I think, obviously there are individual preferences in the contracting process that need to be prioritized and centered as you think about what's most important to you when you negotiate a contract. I think the first red flag, often that we point out or we see is that people do not consult an attorney. You don't always have to hire an attorney to negotiate your contract, but having someone that is familiar with contract terms and contract law to help you answer the questions. There's even a lot of online resources that you can, kind of crowdsource, those types of talents. But I think some of the big things, that we see are similar to the items that Afsheen just raised, which is compensation is always the one that people focus the most attention on, and I think that's appropriate. But underneath even compensation, there are a number of layers that you need to think about. Is that productivity based around RVUs? Is it total hours worked? Does your compensation include, performance bonuses that are generated by the practice or the group? But really understanding the granularity of how you will be paid and what would result in you not being paid the dollar number that's in the contract. I think the second thing is benefit design. I think this is really important for physicians when you think about whether that be, parental leave, whether that be, leave to care for a parent or a sibling, just on the caregiver side, the amount of vacation you get, all of those things are included in and should be negotiated in a contract. And then the third area that I think are red flags are places around restricted covenants. So non-compete clauses, but there are other types of covenants that many people will put in contracts with respect to the ability to transfer you to a different site. And your ability to say yes or no to those things. So a health system could say, you're no longer in Lee Summit, you're going to practice on Independence. And, just making sure that your contract is clear on who has the ability to make those types of decisions. And we have a checklist on our website, and we'll provide links to all those, but we do have a checklist for people to work through around some of these key issues.
Do you see any recommendations for steps that physicians can take if there is something in the contract that they're given that they don't agree with? Because I feel like so many times when we're looking at contracts, we're just told, nope, this is it. And I know it's not. So where do we go from there? What do we do if we don't like it?
Yeah, so the first place I would go is aafp.org/negotiate. And we have an 8-part video series around how to negotiate. And it's not it's not like negotiate from the movies, right? Like this isn't, everybody staring at each other until somebody gives in. These are kind of, soft and hard and persuasive negotiation tactics about how to really advocate for yourself. I think not being a lawyer, but understanding this subject matter, everything is negotiable in a contract, even with an employer that says this is our standard contract for all, newly graduated family physicians. I mean, there are provisions that you can advocate for yourself around. Again, I would look at that video series, and it also includes a number of modules around equity payment, particularly gender equity payment, about how to negotiate so that you can ensure that you're compensated comparatively to all the other physicians in your practice setting.
Great. Any recommendations on, we talked about having a lawyer at least look at our contracts in that process, but do we have to have a lawyer, right? When should physicians be having lawyers do the negotiation for them, or when should we be doing it on our own?
Well, I think probably more often than not, the physicians are going to be negotiating their contracts themselves. I think what you're really looking for is someone that you can ask questions of and who can coach you on, how to approach the conversation with your current employer or future employer around key provisions. Their language matters, and language matters a lot in this space. And sometimes what you think you're asking for isn't really what you're going to get. And when they say yes or they say no. So I would encourage everybody to, have access to an attorney, or at least have a conversation with an attorney. And if you don't think that's appropriate or the financial barriers are too great, I would have a conversation with a senior physician that has negotiated a lot of contracts over the course of their career, just to understand how the process plays out. And I think the thing that, I tell a lot of young family physicians is your health system negotiates hundreds of contracts a month. You negotiate one every 3 or 4 years. So they are really, really good at it. And, this isn't something that you're really, really good at. So you need other people to help you understand how best to approach this. But I think the first hurdle and the one key takeaway from today is just like overcoming the hesitancy to advocate for yourself. They can always say no, but if you don't advocate for yourself in that moment, you will never get the things that are important to you.
Great. Okay. There has been a shift towards physicians being employed by health systems, but many of our, fellow colleagues or other physicians have small clinics or small business owners. What resources are available for these physicians that are also small business owners to negotiate payer contracts or provide HR resources and guidance for mid-level collaborative management?
Yeah, what a great question. So we have a variety of resources around running your practice, quote unquote, running your practice. And we also have a fabulous publication called FPM. It's both a print journal and also available online. And, every publication has, some article or subset of articles around many of these issues with running your practice. And, HR is really difficult. I do a lot of HR every day, and I can tell you it's still really difficult. And HR is just one of those things that's hard, when you don't, even when you do it all the time, like those types of conversations and making sure around performance and hiring and firing of employees are really difficult. And we have resources to help you think about how to go about that. Again, there's a number of crowdsourcing or online resources that are available to small businesses, in the HR and payroll space and things like that. So the independent practices, look, they negotiate a lot of contracts. They negotiate with their payers, they negotiate with their partners, they negotiate with, other, clinicians and entities in the healthcare space, and the skills of negotiation apply. They just are applied in a different way. So I, again, would point people back to those negotiation resources that we've put together. Understanding how to communicate with people and how to advocate on your own behalf is skills that we can all get better at. We're never perfect at them. So I think that would be where I would point them.
Sure, appreciate that answer. So just a little bit more specific, because we have so many direct primary cares in Missouri and it's gaining a lot of popularity here. Any specific or unique considerations for this type of practice?
So on the direct primary care side, we have a whole portfolio of work and resources that are available to them. We have a DPC toolkit that's kind of a collection of resources. DPC has its own unique negotiation, aspects, because you're negotiating with patients around the fees for the practice or the membership fees for the practice. So that's a different level of negotiation than others. You're still negotiating with labs and other partners you may have for cash-based payment rates, et cetera. So again, DPC toolkit, AAFP.org, DPC toolkit, but those same negotiation skills, continue to come back, and the ability to, have effective communications with people is really important. I think the other thing on the independent practices, there's the ability to negotiate contractual terms on the practice by practice basis is governed by state law. And I just want to be clear that, make sure you understand what your state laws are with respect to how you talk about prices and compensation, because you don't want to get yourself in a weird antitrust situation. So there's resources online, or you can, ask the AAFP and we can help you, or the Missouri AAFP can tell you what those laws are in the particular state.
Okay, that's wonderful. Thank you.
Mm-hmm.
Are there any specific places to go to look for local or state resources? Any suggestions there?
There are, particularly around compensation and negotiation. So I'll start with ours because I'm very proud of them. Last year, we launched a career benchmark survey tool that the results are now available, and any member of the AAFP can access that information and look at a variety of things around contractual terms for family physicians, compensation, PTO, parental leave, and kind of see what physicians in the geographic region or state are getting in their contracts with respect to those provisions. There are others, the MGMA has, resources available, medical economics. There's a lot of, you can just Google physician compensation and contract terms and get a variety of resources that become available for you. But I think the AAFP resources are unique in the fact that it's only family physicians. So, in the state of Missouri, if you go to the dashboard, that will only be feedback from family physicians in the state of Missouri. So you can kind of compare contractual terms in a very real way.
Does that information include any data on gender or race and pay gaps that may exist there?
It does if we got enough sample, from a particular state. So a state like Missouri, obviously we have a very robust data set because of a very strong survey response. So, the gender equity discrepancies in payment, continue. We see it in family medicine. I think on average, the survey told us it's about $40,000 or $45,000. Male family physicians make $40,000 to $45,000 more than their female counterparts, and that's kind of irrespective of practice environment. So, it's an inequity in payment structure that continues to exist in the economy broadly, but it certainly exists in family medicine.
Okay.
Are there any systemic steps that are taken to address any of those gaps?
So there's a lot of advocacy. I know we're working with, the Missouri Academy and we work on this at the national level, both with public and private payers. But, we put together a portfolio of work around gender negotiation and just some, opportunities for both those seeking employment and compensation and those hiring. So a lot of this is on the hiring side, right? Like there are decisions being made and they know that these discrepancies in payment exist. And, we need to do a better job of advocating to teach them how to pursue equity in payment as the hiring entity. So this is a very important issue for us as an organization. It's a very important issue for me personally. I've included it in every speech I've given to the Congress of Delegates about how we need to do better in this space as a discipline and just as a country. So I think you'll continue to see more from us, but we do have resources available, tangible resources.
Okay. So the pay and working conditions can have a profound impact on stress and work-life balance.
Yeah.
What resources does the AAFP have to support physician wellness?
Well, we have a large portfolio of work on well-being and resiliency and professional satisfaction and joy in practice, if you will. And a lot of that, covers a wide variety of territory. And some of it is, personal well-being, understanding how you are feeling and how you can manage your own physical and mental responses to the pressures of your practice and life. Administrative burden, how can you reduce the administrative burden in your practice? That seems to be a leading cause of burnout for most family physicians, is just the hassle and frustration of the day-to-day practice. A lot of, the downward pressure that family physicians feel is, balancing their professional lives and their commitment to the calling to care for people with themselves and their families. So teaching people how to prioritize, schedule, kind of balance their time in different ways. And those are skills. It's not I can't just tell you, just be more judicious with your time. I mean, we need to teach you how to do that and how you negotiate with your employers to create a different type of schedule that allows you to do all the things you want to do in your life and allocate your time to the way that makes you healthy, but also brings you professional and personal satisfaction in career. And we have all of that in our well-being portfolio or suite of services on our website. if you really want to dig in and fight around administrative burden, we also have those resources. Your chapter has those resources, how to pass bills to get rid of prior authorization and do some different things like that. But again, I've come back to this often, but I think the most important thing I want people to understand and our members to understand is if nothing is out of bounds in a contract negotiation. Like, you have to advocate for yourself. And again, the answer may be yes, the answer may be no, but it is a negotiation. And if you need certain things that make you a better physician for the patients you care for, then you should advocate for those things. And we have those resources to teach you how to do that.
Yeah, I think that's important that, the AAFP realizes that there are not just personal things that we need to do to help with burnout, right? There are also a lot of systemic factors, but I think ultimately it's both, right? There are systemic factors that contribute, but there are also those personal things that we can do outside of changing the system to try to help just our own personal well-being. But our contracts for our employers make a big difference in that too. Whether or not we can get away from work as often as we want to, or adjust our schedule or our, timing of how we're seeing patients makes a big difference as well.
Yeah, Kara, that's a really good point. I mean, if your contract says you have to close your charts within 24 hours of the patient being seen, but you're also being asked to see, 26, 27 people in a day. I mean, that, those two things are irreconcilable, right? Like, I mean, at some point over 365 days, that's, going to crash. I mean, it's just not possible. So I think all of those things are in contract terms or terms of service for expectations with the employer. And I think what I focus on, I really like the approach that our team has taken internally of giving skills. So we're really in the skill building frame of mind right now, of just helping you navigate things and have the skills to navigate those things. This isn't about, yoga and time off and all those types of things. Those are good in the moment, but, we need to reduce the downward pressure on the practice and let you do what brings you joy. But we also need to give you the skills to navigate those things that you have to do in a more efficient manner.
Perfect. Anything else that you want to leave us with? I think, we've covered a lot of different aspects of contract negotiation and pay and wellness, but anything that we missed or didn't touch on?
So I think the one thing we didn't touch on that I want everybody to be aware of is the fine print in every contract, particularly around restricted covenants, like really understanding what those non-compete clauses are, and also understanding the various trigger dates in any particular contract. So you may be able to get out of the contract, but you may have to let them know on January 8th by 4 p.m. And if you don't let them know at that specific date, at that specific time, that your contract renews for another year. So I think read it several times and understand what those hidden, dates and trigger points are in the contracts, because it may not just renew for 1 year, it may renew for 3 years. And then I also would encourage everybody to understand their rights under termination. So if your health system seeks to terminate you, does it nullify your non-compete, or is your non-compete still in place? What do they owe you from a compensation perspective? Do they owe you any, moving expenses or things like that? And then the third thing I talked about earlier, which is particularly in health systems where they have multiple care sites, is really understanding, are you locked into a single care site, or can that institution or employer move you around anywhere in their system? And we hear this a lot from our physicians. They find out, I use Lee Summit again, they're practicing, Afsheen's happy in Lee Summit, things are going great. And then 2025, she's practicing in Independence, which is a lovely community, and those people probably need care, but she may not want to practice in Independence. And understanding how those contracts work is really important.
Great. Well,
Yeah.
Thank you so much. I think this has been a really interesting discussion, and hopefully it'll be helpful for a lot of our members.
Thank you, guys. Thanks for doing it, and thanks for inviting me.
Thank you, Shawn.
Thank you.